Next, we are here with Dr. Scott Tagawa, who's from the Division of Hematology and Medical Oncology at Weill Cornell Medicine and New-York-Presbyterian Hospital to discuss the latest findings in prostate cancer at the 2019 ASCO Annual Meeting. Hi, Dr. Tagawa, how are you today?
Hi, doing great. Pleasure to be here.
Thank you so much for being here. So there's a lot going on this year at ASCO in prostate cancer. So this year we learned of overall survival data from the phase 3 ENZAMIT trial in metastatic hormone-sensitive prostate cancer. So can you speak to the significance of these data?
Sure. I mean, quite simply, it's great to have another drug that improves overall survival in this very important patient population that walks in the door with metastatic disease. And similar to other drugs before it, and it's another drug that we'll talk about, drugs that work, to some extent in a later stage of disease work even better in earlier stage of disease. So it's just great to have different choices for our patients.
Now, what about apalutamide with the TITAN trial?
So very similarly, similar mechanism of action as enzalutamide, similar but not exactly the same population, also allowing docetaxel, although the percent that received docetaxel, actually sequentially for apalutamide, was lower. But overall, again, another drug that hopefully is going to be available for our patients.
Great. Now, what are your thoughts on the darolutamide health-related quality of life data that we've seen in prostate cancer, and what's really the excitement that surrounds this agent?
So, is a general statement in this M0 castration-resistant population, so not a lot of metastatic disease, presumably not that symptomatic, although there could be fatigue. It's great that we have drugs that work in that space to delay an important event, development of metastatic disease, without a deterioration of quality of life. That's my overall summary of the darolutamide data, as well as the apalutamide and enzalutamide data that came last year. The interesting part about darolutamide in a different patient population, different trials, is that it looked like some of the AE rates were lower. Again, it's cross-trial comparison, so there's caveats with that, but that's very interesting to the field. And there are some planned head-to-head phase 2 type studies that will look to address some of the different toxicity and patient-reported outcomes with the different drugs.
Great. Now, what are some other prostate cancer studies being presented this year that you're really excited about?
Additional studies that were presented yesterday and the day before were of interest were additional data with olaparib. So building on TOPARP A, TOPARP B, really, not a randomized trial, but really validated some of the results we saw in TOPARP A, as well as with at least one other PARP inhibitor, that in a molecularly selected population, there is a good chance of response, and those patients look like they do better than historical controls, in particular because without those types of drugs, it looks like some of those genomic alterations, such as BRCA2, are a worse prognosis without those drugs.
Now, beyond prostate cancer, what are some other abstracts in either bladder cancer or kidney cancer that you'd also like to highlight?
One of the major ones I'm looking forward to are the updated data, phase 2 data with enfortumab vedotin, which is an antibody drug conjugate against Nectin-4. And we've seen some data from their phase 1 trial and expanded phase 1. This will be really their phase 2 data. And from what we've seen, it looked like it's going to hold up, and that could lead to accelerated approval even while the phase 3 trial is going on. So it's great that we've made advances in advanced urothelial carcinoma since cisplatin with immune checkpoint inhibitors that work very well, but just in a subset. Right. Erdafitinib was just approved in a subset, but very important for that disease subset. And hopefully we'll have at least one, if not multiple, antibody drug conjugates down the line.
So if you had a crystal ball in front of you and you were looking at the field of prostate cancer 5 years from now, what does it look like to you?
So what we've done over the last 5 years is come up with new drugs that importantly have led to advances in survival as well as patient-reported outcomes in different disease settings and have moved existing drugs forward. At the same time, we've been working on biomarkers to select out patients who are more likely or less likely to benefit from these drugs. And I think it's going to be more of the same in a way, but with additional drugs and new targets. So I think there'll be new drugs that are out there that will work in tumors that may have resistance to the existing drugs. We'll move those drugs earlier, and hopefully with a patient sitting in front of me with drug A and drug B as choices, I will be able to pick which one I think will be better for that individual based on clinical and genomic and other biomarker factors.
Well, Dr. Tagawa, thank you so much for sharing your insight today on all that is happening in prostate cancer here at ASCO. I really appreciate it.
No problem. It's a pleasure.